Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Walt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today, we're thrilled to have as our guest Nicholas Hall, Principal of the Nicholas Hall Group of Companies and one of the world's leading experts on self-care. Nicholas, great to have you with us.
Thanks, Jeff. Thanks for the invite to come back.
Let me begin by asking you about COVID. People's attitudes towards health and wellness changed considerably as a result of COVID. How has that impacted the over-the-counter pharmaceutical market?
So when we look at the US figures, which I think will probably be of more interest to your listeners, then what we see is a market that in 21 grew by 8.5%. I mean, I've been in this industry over 40 years. I know you've been in the industry a long time too, Jeff. We haven't seen growth like this. I mean, it was almost double digit. I'm talking here US 8.5%, but global 7.5%. And then it kind of eased off a little bit in the US. It went down below the global level, but it was still pretty good, averaging around about 4%. It's only in the last 12 months that we're seeing a real decline, and it's running at about 0.5%. But again, we have to see that in the context. That's 0.5% on top of all those huge growth rates we had in the previous years. And by the way, this data set, which is our own data, doesn't include e-commerce. And e-commerce is very big in the US, but I don't think it has so much growth as in the past. But anyway, the retail sector, which is still about 65 to 70% of total revenues for consumer health in the United States, flatlining, but from a very high base. So what drove that? Well, I think what happened was that consumers got frightened and they started to reach out to products in a panicked way. And then they realized they didn't need to do all the things that they were being told to do. You know, you didn't need to use the hand sanitizer in quite the same way. You didn't need to fill yourself up with immunity products. So they settled down. But I'd say that one of the questions I know you want to talk about is what is the lasting impact of COVID? And I would say that it's kind of put a little bit of a boot into the growth of prevention products. Before the pandemic, we were looking at data where almost all the growth categories were to do with prevention. Now treatment and hybrid products have come back very strongly, and we're seeing post-COVID a return to the sales of stomach remedies and topical analgesics, which weren't being used so much in the pandemic. We're seeing still high growth of multivitamins, but the specialist vitamins have eased back a little bit. Probiotics has not come back as strongly as before the pandemic. And I think that's almost because, not particularly to do with the pandemic, but probably more the economic recession, is the fact that consumers have to be much more choosy about how they use their disposable income. And it would appear that many consumers now want to get something very tangible as a benefit rather than take a tablet now, which might prevent you getting ill in 2 years' time. So it's more bang for your buck and a trading down. Consumers definitely trading down, private label or generics or smaller packs. And that's why when we look at the figures from the top companies, what we're seeing generally is growth in value through price increase, but no growth in volume. And I think that's a mixture of factors there. One is some consumers are just leaving the market, or they filled the medicine chest up in the pandemic and they've still got tons of stock on hand, or they're substituting private label for a brand. That's obviously, for most of the industry, that's quite a dangerous trend. Great if you're in the private label business.
Let me ask you this. Have consumer attitudes towards self-care versus physician care or clinic care changed as a result of that experience?
Yes, I think, and that's one of the sustainable changes from COVID, that during COVID, consumers couldn't get out so much at one stage. They couldn't get to see their doctors. They could barely get out to see their pharmacists. And I think those refuseniks, those people who didn't like the concept of buying a medical product, any medical product, without the doctor's endorsement, they were forced into the traditional way or use Dr. Google or rely on family and friends for advice. And that seems to have stuck. And I think that of course, the US was always a big self-care market. It's about 2/3 of the units in healthcare in the United States are from consumer. In the rest of the world, we've seen a big movement away from the doctor, who's now not consulted about simple. I'm generalizing, but in general terms, it's not being consulted so much for simple, mild to moderate conditions.
What should retailers and OTC manufacturers be doing to better inform consumers about their products and what their products can do for them?
The first thing is we have to get away from this Me Tooism that's haunting the industry at the moment. When I first came to the US for this industry, obviously I've been many times before, in 1990, Switch was the main talking point. But now the conversation is about how can we get products into the market quickly and cheaply, particularly in the US, but in many other world markets. So what we tend to do is to have very simple changes. So if I tell you that we have a product called New Products Tracker, it's been going for about 13 years, and we've measured 52,000 new products in 21 countries. And before they're put on the market, we evaluate them as 4-star, which means open a new category, very few of them. 3-star is game changer within an existing category, very few of them. 2-star is a Me Too, but with a small point of difference, and 1-star is no change at all. And I'm shocked to say that 95% of all new products launched worldwide in 21 countries over the past 13 years, 95% of those products are 2 and 1-star. In other words, hardly any point of difference. Some succeed big because they come under a brand umbrella and they've got lots of investment or go into a new country. But the real innovation, and we talk about this being an innovative industry, the real innovation, which are the 4-stars, we've had about 100 of those, and that includes if a new brand is launched in 10 countries, that's 10 of those 100. And we've a few more, but only a few hundred. In fact, it's about 1,000 3-stars, but again with duplication. So this is an industry, and I'm going to offend many of my friends here. This is an industry that talks big about innovation but doesn't innovate. Mm-hmm. Now, I think the consumer is looking for better products that does a different job, brings new benefits, or does the old job better, faster. Of course, they'd also like it to be cheaper, but that's not normally what we're offering. So I think everybody in the line, whether it's the R&D company, whether it's the manufacturer, the marketer, the distributor, all those should be focusing on bringing out fewer, better, bigger products, and that will unlock the consumer's purse, because that will also unlock the consumer's heart, and they'll see the benefit and they'll spend more. And of course, our consumer is usually a woman, so I say queen consumer, not king consumer, and unlocking the purse, not the wallet.
That's a great point, but what do you think suppliers need to do? And this may be hard to generalize, but what do they need to do to get more 3 and 4-star products coming out of their R&D efforts?
Well, first of all, I think they have to find a better way to evaluate the likely success, and I think AI will play a part in that. But even if you use the more traditional means of talking to consumers, we need to do more consumer research. And when I talk to a number of my big clients, what they tend to do is to put a lot of resource into a lot of options, and then by the time they've narrowed it down to 1 or 2 really big ones, they've spent the money, and the last step is done more judgmentally. I'm generalizing again. Mm-hmm. There are companies, and within companies there are people who do take a very methodical approach and really do a good job of clinical research and consumer research. But generally, I think new product development is all about getting a product into the market quickly. It's finding a way around the regulatory hurdles. Now, we play a part in that as a consultancy. We advise on regulatory as well. And I think that we take shortcuts for short-term gains. And again, I get that. I'm an owner of a business. I know you have to make target to pay the salaries. But what concerns me is that stripping out R&D is relatively straightforward. It's easy, and you don't suffer in the short term, but you do suffer in the long term. Now, one of our biggest categories, in fact, it's in many countries the biggest category, is vitamins, minerals, and supplements, and yet there are very few science-led supplements. Now, you'll read the reverse of that. Every company claims it's evidence-based, but often that's small-scale trials in the public domain or run by a raw material supplier. And what I don't see are very many seeking OTC registration for supplements, natural products, which gives you a chance to make claims. Now, you have DSHEA in the US, which is great. We don't have that in the rest of the world. So you can make claims, some claims about natural products which aren't registered. In the rest of the world, we don't have that. So we can't make claims at all. But I think the more we can do some real proprietary research on supplements, make claims, the consumer is happier, the sales are higher, so the distributor is happier, the retailer, the marketer, the manufacturer, and the raw material supplier. Everybody wins. Even consultants might get a little share of that. So I keep saying to my clients, we've got to spend more money on R&D. And they say, no, the dynamic is to go the other way. We spend less on R&D. And I think that's such a pity.
When you talk about this plethora of products, most of which are not innovative, not moving the category forward, what role can and should pharmacists and physicians play in helping people sort through that sea of options?
One of the problems we face is that in many countries, the doctor, the general practitioner, doesn't believe that they should be involved in any way in recommending consumer products, unless there's no prescription product that would be appropriate, or in a few isolated instances. Now, we see in countries like France and Germany and Italy, some doctors do actually recommend consumer products, and some even recommend supplements, but it's not universal. And I think that the last comment, which is that if our supplements could be registered and make claims, I think healthcare professionals would feel more confident in recommending them. Now, we've already said that it's hard to get to see a doctor. There aren't enough of them in the United States. There are queues in the rest of the world. And apart from independent pharmacists, you generally don't see the pharmacist in the big chain stores because they're dispensing. And if you've got a problem with your prescription, the pharmacist will come and talk to you. But if you say, I want to talk to somebody about, I've got a problem, I'd like to talk to somebody, you might be lucky in a chain store. You're much more likely to be able to do that with an independent pharmacy, but they account for a small share of the market. But that's not how the US is set up. The US is really set up for self-selection. So where does a consumer who wants information get advice? The internet. The trouble is, the internet is unregulated. Who knows if the advice you're getting is the right advice, or you might get contradictory advice. So I think that who recommends is such an important topic, and I don't think the industry, although we debate it eternally, I don't think we have the right solution. Obviously, there are some of the online physician organizations, WebMD, and there's Hello Health in Asia that is very similar. But again, they are commercial enterprises. They rely on sponsorship, and is the advice impartial? They would say it is, but in absolute terms, is it impartial? So we strongly believe in what's called pharmacy point of care, where the pharmacist has a real engagement with the customer, can give medical advice, and that's being incentivized in countries like the UK, where now pharmacists can counter prescribe an RX product without needing a doctor's prescription on the strength of their professional knowledge. And of course, we're talking about simpler conditions here. We're not talking about cancer or anything like that. But I think this is a very healthy trend. It's a lot cheaper for the patient. It's good business for the pharmacist. And it takes people who are not really ill, not seriously ill, out of the doctor's surgery.
I mean, that seems to be everybody's goal. Everyone talks about it. As you say, you do see it in the UK to some degree, in Canada to quite an extent. But is it realistic? Do pharmacists have the time to get engaged in that? I mean, we see so many stores closing here in the US these days. How do you think about that dynamic?
Let's look at the various stakeholders here. The independent pharmacy, that's really all they've got, apart from location, is the human touch. So I'm not surprised that you can go into any rural town like our market towns here in England, but that you have them. I'm thinking of places like Madison in New Jersey, and you can go in and you can talk to pharmacists there and you get great advice. But that's a small part of the market. When you come to the chains, you might say, well, they're doing okay, so why would they bother? Well, are they doing okay? I mean, we've just seen the restructuring of Walgreens into private equity, partly a result of reduced footfall, but I think there are lots of other factors, of course. But of course, their competition isn't just CVS down the street or the independent, it's e-commerce, it's Amazon. So what's the one thing that the pharmacy has that Amazon doesn't have yet? And that's the ability to talk face to face with a customer who's got a problem and who wants some advice. And if they don't seize that opportunity, the business is going to go even more to Amazon than the 30% of the market that they have, or I should say the total e-commerce sector has. And in Asia, we're seeing that now with the equivalent of Amazon, which is called Alibaba, you can actually have a live chat with a dermatologist or a pediatrician. And these are qualified individuals. The government is making sure these are qualified individuals. So if you're not entirely sure of what you're buying, you can get some advice on a chat line. I think that's going to become a universal trend, and it's going to give such an edge to e-commerce that retail has really got to look out, and they can do a better job, but they've got to take the steps. And they tried, you know better than me, Jeff. The big stores tried the in-store clinics, and that was not a success for various reasons. I mean, there are still some holdouts, but it has not been the great game changer that we were promised a few years ago. But the pharmacist in the store, by the dispensary, if they can find time and if they can cover their costs with that, that's the way that the bricks and mortar will take back business from e-commerce.
Thanks for sharing your insights with us, Nicholas. I look forward to continuing the discussion next week.